pull some teeth. You'll be fine. You'll be okay. CanCat is at the vet right now, and they just did an x-ray, and the vet called me, and they told me that she has 3 teeth that definitely need removed, that are broken, or the crown is missing, or I don't remember what she said. And then she said 4 teeth seem to have reabsorbed or something. This is how well I pay attention, right? And she was just calling to ask me what I wanted to do about it. Like, do I want it just removed to 3, or is it okay if they go in and extract the 4 that are, like, I guess in the gums or something? I don't know. I said, do whatever you have to do, okay? Whatever it is, do it. And when I brought her in this morning, they asked me if I wanted to give her pain medicine. Like, do people really, like, take their animals to get surgery and then not give them pain meds? Like, that's awful. Like, don't do that. I know it costs more, but my God, like, I can't imagine. A couple years ago, I had an emergency gallbladder removal, and the stone in my gallbladder hurt so much. Not as bad as my kidney stone. I had a kidney stone removed too, but the gallbladder stone, I thought at the time, it was because I woke up in the middle of the night, and I thought, because it was like right here, like the pain was right here, and I thought, is it because I'm smoking? I said, I'll never smoke again because it hurts so bad. It was like 3 a.m. and it was just like pain. And I couldn't really tell where it was because your lungs are like up here. They're not that low. But I was laying down. So then I stood up and I realized it was lower. And I'm like, there is something wrong. So when I went to the ER, they immediately put me on every freaking painkiller that there is. They gave me, what's the one that starts with D? I can't remember. I'll put it on the screen if I can look it up. They put me on the one that starts with the D, and then they put me on the one that people are, oh my God, I can't think, the one that starts with F. And they also put me on morphine. Like, I was so drugged up the entire time because they couldn't remove my gallbladder until like the morning, because it was only like 3 a.m, and so they couldn't like do it till like 8 or 9 or whatever. So I was like drugged up all until then, and then after they took my gallbladder, they drugged me up even more. Anyways, my point being that fentanyl, that's what it is. Fentanyl, they put me on the one that starts with D, then they put me on fentanyl, and then put me on morphine. My point is if you're going to do a surgery on an animal, please give them pain medicine. I can't imagine having to suffer in silence because animals don't have a voice to say out loud in words, hey, I'm in pain. And a lot of people, oddly enough, don't see the body language that says they're in pain. So anyways, that's my little PSA of the day. So now I'm just waiting for them to do the surgery and to call me, and then I'm going to go pick her up. And I'll show you. Oh, and I also asked if I could keep her teeth. They said, they probably won't be like a full tooth, which is fine, but they said they'd give me whatever pieces they pull out because I just want to see them. I asked if I could have my kidney stone. They wouldn't give it to me. I asked if I could have my gallbladder stone. They wouldn't give it to me either. And I was like, because I wanted them. I made them. They're mine. Anyways, all right, I'll get back to you guys after I pick up my cat. Okay, so looking like a hot mess. That's per usual. I'm here to pick up CanCat. I'm just a little bit early. They called me and said that everything went well. They gave her a post-operative pain medicine, and then I could come get her. And one thing I did want to address in this video, because it's not going to be a very long video if I don't say stuff. I found out, one time I had an interview at a veterinary hospital, and they showed me the entire place and how they lock up the narcotics, the pain meds and stuff like that. Some guy just walked by. He's like in the video. Okay, I have to edit that part out. So I have explained about giving your animals pain pills. And they actually, at the vets, they have to lock those things up. They have to sign them out, how many pills and how much and blah, blah, blah. So I know kind of like the process of a little bit. I've never actually worked at a vet. I didn't get the job, let's just say. That was a while ago. But they told me that people will pick up like an animal off the streets or adopt an animal or whatever and physically hurt the animal, bring it to a veterinarian, and then ask for pain meds, and you take them themselves, like, because they're a drug addict. And I'm just like, this really happens in real life. Like, that is so sad. Okay, for one thing, hurting an animal on purpose makes my blood boil. Like, I'm not gonna lie. Like, that just, you know, hurting children, hurting elderly, or hurting animals, hurting anyone really, you know. It's upsetting. It's very upsetting. And the fact that you're gonna do that for your own selfish needs, and it's also sad that they're addicted to drugs to the point where they're gonna go and do something like that. But I mean, what a world we live in, right? Like, that's just awful. So just be aware that there are people in this world like that. Like, I guess I just kind of live in my own little fantasy world because I stay at home a lot, don't get out much. I hate watching the news. I mean, I end up watching it sometimes, and I can't avoid the news all the time, but like, it's always bad. Like, there's never good news. And the fact that there are people out there hurting animals to get pain medication, like, anyways, that's not what I would ever do. I don't recommend it. Please get off my channel if that's what you do. I don't want to be associated with any people like that whatsoever. But that's a thing, apparently. So anyways, I'm going to go in, get my cat, give her pain medicine that she rightfully deserves for going through surgery and probably being in a lot of pain. I mean, imagine tooth pain can't be great. All right, so let's go get her. Enough of me rambling. Okay. You want to tell them how you feel? She looks so dejected. I know, right? What do we do to you? What happened? Oh, honey. Doesn't even look at me. She's like, you did this to me. Get out of my face. Okay, so when they coded me for this dental surgery, they said it was going to be between $970 to $1,100. And I just paid, and it was only like $430 some. And I was like, that's it? And they're like, yeah, we like to quote high. That's really high to quote. Jeez. That would like turn away some people, but I guess they have to in case of, you know, they need certain things during the surgery that come up or whatever. But I'm very happy that it was like over less than half of what they quoted me. CanCat got her medicine. I have her medicine here. They gave me, all her medicine is in like these syringes. So they're like pre-marked. So like, I don't even have to measure anything, which is nice. They gave me some dental treats here. And, they gave me this, I think this is the, like antibiotics or whatever. So those are those things there. And also, I asked for this, and they probably think I'm a big weirdo, but I don't care. They gave me her teeth. I'm going to show you them right now. What they could give me of her teeth. Ew. Ew. They're like, they have like pieces of flesh on them. Let me turn the camera around. So those are her teeth right there. So that's like the biggest one, I guess, huh? And then that one looks like kind of like maybe a molar or something. I don't know. Just playing with bloody cat teeth in a parking lot. That's normal. Anyways, this one at least looks kind of neat. I might keep that one. And I thought I'd show you guys that I'm a big weirdo, I guess. So this was a picture they took before the surgery. And this is the picture they took after the surgery. So it looks like that big tooth maybe was this one right here, maybe. And then these are all the teeth that were taken out, the red ones. So 1, 2, 3, 4, 5, 6. I don't know what that yellow means. And the blue ones here mean that she didn't have these teeth to begin with. So, yeah. Yeah. Okay, so I've been sitting in the parking lot for way too long now, and it's looking kind of creepy probably. So I'm gonna go home and set her up. I'm gonna cage her just for maybe tonight, just to keep an eye on her. And plus I gotta give her medicine, and I don't feel like having to like find her in the closet to give her medicine tonight. And we'll go from there. Okay, so I'm just gonna keep her in here tonight so I can give her meds. Her meds, I actually have to give them to her like after my own bedtime. So I don't want to have to hunt her down. I might record that just so you can see that I'm giving her medication. And I give her some water. I don't think she's gonna want to eat tonight. I will offer her some food in the morning. And I'm gonna cover her completely whenever I go to bed so that Otis doesn't try to like mess with her. So yeah, I'll probably see you guys when I give her meds. So she was busy. She got her bandage off in the cage. She does not want to be in the cage, so I'm gonna let her go free now after this. So the first thing we're gonna give her is an antibiotic, and it's 1 milliliter, what does it say? 1 milliliter every 12 hours as an antibiotic. Did I say antiseptic? I'm tired. It's midnight. Okay, so let's give her this. That's this dropper right here. This is gonna be fun to do on camera. Scruffer and... Yeah, I know. It doesn't taste great, I'm sure. This is the face of an unhappy cat. Look at the ears. She's like, I hate you. All right. This is the good stuff right here. This one says... This one's called... what is it? Does it say what it is? Oh. Buprenorphine. Buprenorphine. The other one was called clindamycin. This one's called buprenorphine. And this one says 16 milliliters, or 0.16, 0.16. If it was 16 milliliters, I'd probably kill her. This is why I couldn't be a vet. By mouth every 12 hours, twice daily, for 3 days for pain management. They already have them pre-marked. So... Also, Otis is outside for the night, so she won't be harassed. Okay. I'm gonna let you go out into the wild now. You're such a good kitty. I'm sorry you had to go through all that. Anyways, I'm gonna end my vlog here, guys, and I'll keep you guys updated throughout my other videos on how she's doing, but I think she's gonna be just fine. She might fight me with the medicine, but I think she's gonna heal just fine. All right, thank you guys so much for watching, and I'll see you guys in the next one.